I had a patient that came in that was not your typical sleep apnea patient. He wrote me a letter. I also suffer from dry eyes and have been receiving treatment for dry eyes, but it has never worked. At night, the glare from oncoming headlight made driving more difficult, and I used to struggle with eye fatigue almost every day, even during the daytime. His sleep had been severe, and he tried different things that didn't work for him, and we did the NightLase procedure. Even before completing my first course of treatment, I already noticed improvement in the airflow through my throat. The next morning, I woke up feeling as though I could breathe in fresh air all the way down to my stomach, and immediately felt convinced that this was the beginning for a new chapter of my life. So NightLase is a procedure we use to treat both sleep apnea and snoring. And sleep apnea is defined as having episodes where you stop or underbreathe for 10 seconds at a time. What happens with sleep apnea is it significantly impairs your ability to get deep sleep. You might feel you're sleeping fine as you fall right to sleep, but then you're having these episodes at night and your sleep is disrupted. And during these apneic episodes, it does impair the body from going into different stages of sleep. And the lack of deep sleep leads to the inability for our brain to clear out toxins. So we look at something called the lymphatic system that does clear out our brain and helps it kind of regenerate. And deep sleep is important. But also there's other systems that are affected by sleep apnea, such as the cardiovascular system, the gastrointestinal system, and even the brain. I had a patient that came in that was not your typical sleep apnea patient. His sleep had been severe, and he had tried different things that didn't work for him. And we did the NightLase procedure. He had 5 of them. Typically we do 3 to 5 bed of severity. He came in to see me to talk about some other issues regarding what can he do for different things in his health. He wrote me a letter. I'm a patient, Dr. Mocha. I've been struggling with sleep apnea. My first NightLase was on the last day of 2024. This must have been around December. Even before completing my first course of treatment, I already noticed improvement in the airflow through my throat. The next morning, I woke up feeling as though I could breathe in fresh air all the way down to my stomach, and immediately felt convinced that this was the beginning for a new chapter of my life. After waking up, I went to the bathroom and was amazed to find that the constipation I've had and dealing with for years had vanished, and it's been gone since, so 6-8 months. What's more is this improvement has lasted continuously again 6 months. Based on my understanding, I believe constipation is completely resolved. This is interesting. We know there's a microbiome effect on sleep apnea. Even though I used to eat a lot of vegetables, didn't help. Never thought the sleep quality was a root cause. I also suffer from dry eyes and have been receiving treatment for dry eyes, but it has never worked. At night, the glare from oncoming headlight made driving more difficult, and I used to struggle with eye fatigue almost every day, even during the daytime. However, since receiving the NightLase treatment, my dry eye symptoms have gradually improved. My daytime eye fatigue has significantly lessened, and the discomfort has disappeared. It's a huge for me to return back to normal traveling life. Furthermore, since undergoing NightLase treatment, I have not experienced any episodes of severe drowsiness while driving. After driving more than an hour, I can remain focused on any issues. And that's an interesting thing, is sleep apnea is very common in truck drivers who are driving these, $40,000 killing machines. This has been a major turning point in my life. At work, I've noticed remarkable improvement in my ability to follow conversations. While not in every single case, I can now listen to long discussions from beginning to end and understand the content much better than before. In contrast, throughout my long life before treatment, I often found myself unable to understand the beginning of what someone was saying. I was able to understand the beginning of what they were saying, but then unable to stay focused to the rest. My mind would wander over things, and I'd lose track of the conversation. I can only imagine how much extra time I must have spent trying to do my work because of that issue. I regret that I didn't know about the late NightLase treatment from Allure and Dr. Mocha earlier. I'm much healthier than before. I'm excited to challenge more things which were not in my mind before. Indeed, thank you for helping improve my family life. We see things like erectile dysfunction get better, daytime drowsiness get better, sharpness get better. We've also documented reversal of brain age after NightLase treatment. So we get neuroquantitative imaging with MRI. And if somebody's at risk for Alzheimer's disease, we can measure and detect it well before it occurs and see the brain is relatively shrunk and the fluid has increased. And after NightLase treatments, we've documented this having some reversal, substantial reversal. And we know that if you have sleep apnea and you treat it, you slow down cognitive decline. This is such a passionate thing of mine. I'm disturbed by the fact that doctors don't routinely screen people for sleep apnea. It's very easy to do. I think there's a disincentive for doctors to do it because they got to do a lot of paperwork for it. But basically, you can go online and get this done. You can go just look for the WatchPat, W-A-T-C-H, WatchPat, P-A-T. So they're very inexpensive. If you have sleep apnea, many treatments for it, not just NightLase, that's what we offer, but there's a surgery that is like a pacemaker that stimulates your throat. There's something called a CPAP machine. Those are maybe unpleasant. There's also dental devices, dental appliances that can help with sleep apnea, basically reduce it 60-70%. So the message I'm trying to get out is, I don't care how you treat your sleep apnea, find out if you have it and get it treated. This will extend your lifespan, extend your health span, and improve your life.